The ambulance doors opened into controlled noise. Not panic. Not yet. Just urgency held tightly in trained hands. Two paramedics stepped out first, faces set, uniforms marked with drying blood. Behind them, the gurney rolled fast over the concrete ramp, wheels rattling as they crossed the threshold into the emergency bay. On it lay a man in desert tan tactical trousers, cut open at the thigh, compression bandage soaked dark. His chest was wrapped tight, oxygen mask fogging faintly with each uneven breath. A subdued American flag patch clung to what remained of his torn sleeve. The rest had been cut away. Walking beside the gurney was the dog, large, muscled, dark-coated Belgian Malinois. No leash, no hesitation. His shoulder brushed the metal frame as if he were physically holding it upright. The first growl started when an orderly reached instinctively to help steer. It was low, almost mechanical, a warning more than a threat. The orderly froze. The paramedic did not look surprised. "He stays," he said shortly. "He doesn't separate." Inside Trauma Bay 3, lights snapped brighter, monitors were prepped, surgical trays clattered into position. The attending physician, Dr. Harlow, issued fast instructions without raising his voice. Type and cross, prep for imaging, notify OR. The dog entered with them. That was the moment the room shifted. The Malinois positioned himself between the gurney and everyone else, paws planted, ears forward, eyes tracking every movement. When a nurse attempted to adjust the IV line, the dog's lips peeled back just enough to show intent. Not frantic, controlled. He was not confused. He was guarding. Security arrived but did not advance. One of the paramedics spoke quietly. "Explosive detection and direct action trained. Multiple deployments. Handler is the patient." The word settled over the room. Handler. This was not a pet. This was a partner. On the far side of the trauma bay, near the supply cabinet, stood the newest member of the night shift. Her badge still looked unfamiliar on her scrubs. Emily Reyes. 6 weeks into the job. She had been restocking saline when the ambulance call came in. No one had assigned her anything yet. She observed. That was what she did well. She did not look at the dog first. She looked at the man. Not at the blood. At the way his hands rested, calloused knuckles, faint scars across the fingers, compression bruising along the forearm consistent with recoil or repeated impact. She noticed the partially removed shoulder patch lying in a plastic evidence bag on the counter. It had not been thrown away. Someone had preserved it. She noticed something else. The dog's stance was not random aggression. His body was angled toward the soldier's torso, not the door. He was protecting the center mass. He believed the threat was proximity, not intrusion. When the respiratory therapist stepped too quickly toward the head of the bed, the dog lunged, not to bite but to block. Teeth snapped inches from fabric. A collective intake of breath filled the room. "We sedate the dog," someone muttered. Dr. Harlow did not answer immediately. His eyes were on the patient's monitor, blood pressure slipping, not crashing yet, but trending down. "If we can't intubate cleanly, he's done," another nurse whispered. Emily moved closer, not toward the dog, but toward the foot of the bed, where she could see both patient and animal in the same line of sight. The Malinois' chest was rising fast, stress breathing. His paws were slick with the soldier's blood. He had likely refused transport separation from the field. That meant exposure to gunfire, explosives, chaos. His adrenaline had not dropped yet. Sedating him abruptly could trigger a defensive strike, or worse, trauma shock. "Doctor," Emily said quietly. Her voice did not cut through the room. It slipped into it. "If you sedate him without handler cue, he may escalate." Several heads turned. She felt it, the unspoken reminder that she was new, that there were more experienced voices present. She did not defend herself. She simply continued. "He's scanning for threat patterns, not random movement. We're approaching from multiple angles. That reads as surround." The dog's ears twitched at overlapping voices. His gaze flicked from one set of hands to another, always returning to the man on the table. Dr. Harlow studied the animal now instead of the chart. "Suggestions?" he asked, still calm. Emily shifted one tray 6 inches to the left, clearing visual clutter between the dog and the soldier's face. The growl lowered a fraction. "Reduce motion. 1 approach line. Slow hands. No eye contact." She did not say how she knew. The paramedic nearest her gave a short, assessing look. "You worked K9 before?" he asked. She did not answer directly. "Not here," she said. It was true. Another nurse attempted to step forward with gauze. The dog's posture tightened instantly. Emily noticed the trigger. Eye contact sustained too long. Dominance perceived. She moved slightly, blocking that line without touching anyone. "Don't challenge him," she murmured. The room adjusted almost unconsciously around her instructions, not because of authority, because it was working. The dog's breathing slowed marginally. The soldier on the gurney gave a faint, involuntary movement, a tremor in his fingers. The Malinois reacted instantly, placing his muzzle against the man's arm, a soft chuff replacing the growl for half a second. The connection was absolute. Emily's eyes shifted to the soldier's neck. She saw the faint edge of ink beneath dried blood. Not decorative, tactical. Coordinates? No. Unit marking. The kind not worn for display. Her expression did not change, but something settled behind her eyes. Recognition carefully contained. Outside the trauma bay, boots echoed in the corridor, heavier than hospital staff. Measured. Military. The sound made the dog's head lift sharply. His muscles coiled again. Early warning signs were stacking now. Blood loss increasing, surgery delay, external presence approaching, and a combat-trained animal on edge inside a civilian hospital. Emily inhaled slowly through her nose. Controlled, matching her breathing to the rhythm she wanted the dog to adopt. She did not step toward him. Not yet. The room felt suspended between action and escalation. Dr. Harlow checked the monitor again. "We have minutes," he said quietly. The boots stopped just outside the glass doors. The handle shifted. The dog's growl returned, deeper this time. Not fear. Anticipation. Emily understood what the others did not. The dog was not refusing treatment. He was waiting for a signal, a specific one, and no one in this room knew how to give it. She took one small step forward, close enough now to see the soldier's dog tags resting against his collarbone. One tag had been bent. The Malinois' eyes flicked to her, evaluating, measuring. The rest of the room held its breath. They still saw her as the rookie nurse, the extra set of hands, the newest badge in Trauma Bay 3. They did not see what the dog was beginning to test, and the night had only just begun. The threat at the door. The glass doors slid open with controlled force, not rushed, but decisive. 2 uniformed military police entered first, weapons holstered but visible, posture rigid. Behind them walked a man in a dark civilian suit, carrying no badge on his jacket, only a folded leather credential case in his hand. He did not look at the staff. He looked at the patient. The dog's growl deepened instantly, shifting in tone from defensive to alert. Recognition of new variables. The suited man stopped 3 steps inside the room. "Status," he said, voice level. Dr. Harlow did not step back. "Unstable. Internal bleed suspected. We are delayed." His eyes flicked briefly toward the dog, an unspoken explanation. The suited man followed the glance. He assessed the Malinois in one long look, then the room, then the young nurse standing near the foot of the bed. He noticed her position, not random, strategic. "That animal is trained under federal directive," he said calmly. "No one touches him without authorization." The hospital administrator, who had hurried down from the 3rd floor, interjected with visible strain. "With respect, sir, this is a medical facility. If the dog interferes with surgery—" "He is not interfering," the man replied. "He is guarding." The word changed the atmosphere. Not pet, not obstacle. Asset. The soldier's blood pressure dipped another point. A quiet alarm sounded. The respiratory therapist hesitated again. The dog shifted his weight, muscles tightening along his spine. The administrator whispered sharply, "Sedate it. We cannot operate like this." One of the military police stiffened. "Negative," he said immediately. The room fractured into opposing authority lines. Civilian protocol versus operational command. Emily watched the fracture forming before it widened. She recognized it from somewhere far removed from hospital floors. Competing hierarchies under stress create delay. Delay costs lives. The suited man opened his credential case briefly, just enough for Dr. Harlow to see the seal inside. Federal, specific division not stated. This operator was injured during an ongoing domestic counterterror investigation, he said quietly. Details are compartmentalized. We need him alive. We also need discretion. No media. No unnecessary sedation. No public incident. The administrator swallowed. We need surgical access. The dog's ears flicked at the rising tension. He interpreted tone before words. Emily stepped slightly to the side, adjusting her angle so the dog could see both the soldier's face and the primary surgical tray without turning his body. It was subtle, but the growl decreased half a notch. The suited man noticed. His gaze rested on her a second longer than professional courtesy required. "You," he said calmly. "You understand K9 posture." It was not a question. Emily did not straighten or perform confidence. "He's waiting for handler instruction," she replied. "He won't accept force. He will escalate." One of the military police nodded almost imperceptibly. The administrator exhaled in frustration. "Then what is the alternative?" The soldier's breathing hitched, shallow and uneven. Monitor tones sharpened slightly. Emily felt the clock without looking at it. She also felt the eyes on her. Senior staff, federal authority, armed personnel. Weight of scrutiny. She did not react to it. "1 minute," she said. "Alone space. Minimal motion. No direct stare. If I'm wrong, you sedate him." The administrator stared at her as if she had overstepped. "You are a junior nurse." "Yes," she said simply. The suited man studied her face, searching for something. Panic, ego, uncertainty. He found none, only calculation. "What are you proposing to do?" he asked quietly. She met his gaze briefly, then returned her attention to the dog. "Give him a reason to stand down." Silence held for 2 seconds. The soldier's blood pressure dipped again. That decided it. Dr. Harlow spoke first. "You have 60 seconds." The administrator opened his mouth to protest, but stopped when the suited man gave the smallest nod of approval. The military police stepped back toward the doorway, reducing visual pressure inside the room. Staff froze their movements. The overhead light hum seemed louder in the stillness. Emily removed her gloves slowly, placing them on the tray without sudden motion. Bare hands signaled non-threat. She adjusted her breathing deliberately, slowing her heart rate. The dog's eyes tracked every inch of movement. He did not growl now. He assessed. She lowered her posture slightly, not crouching, not towering. Balanced. She avoided direct eye contact, letting her gaze rest at the level of his shoulder. Respect without challenge. The soldier's fingers twitched faintly again. The Malinois leaned closer to him, protective instinct spiking. Emily noted the pattern. The dog was not guarding the room. He was guarding consciousness, waiting for a command that would not come. The suited man watched her as if reviewing a classified file in real time. Something about her composure did not align with her badge. Something practiced. The administrator shifted nervously near the wall, but did not interfere. 60 seconds in a trauma bay can stretch into consequence. Emily took one controlled step forward, close enough now that the dog could scent her clearly. Hospital soap, sterile gauze, and beneath that, something older. Faint traces of training fields, cordite memory buried in fabric long washed. The dog's head tilted a fraction. Recognition flickered but did not settle. Not yet. The room felt suspended on a single decision point. Outside the bay, distant sirens echoed from the city streets. Inside, only breath and monitors remained. Emily leaned just slightly closer to the dog's ear line, careful not to cross into threat range. The suited man's voice cut softly through the tension. "If this goes wrong, we intervene." She did not look at him. Understood. The 60 seconds were almost gone. The soldier's pressure dropped another point. Dr. Harlow's jaw tightened. This was the edge. Either the dog would stand down voluntarily, or force would shatter the room. Emily inhaled once more, steady and measured, preparing to speak the one thing no one else in this hospital could possibly know. The whisper. The room had narrowed to a single line of tension stretching between the dog's eyes and the unconscious man on the table. Emily did not rush the moment. She let the silence settle fully, because abrupt sound would read as threat. The Malinois' ears were forward, pupils wide but focused, every muscle primed for decision. She leaned just enough so her voice would not carry beyond him. What she said was barely audible, a low breath shaped into words that were not English. Not exactly. A clipped sequence, a cadence, the kind drilled into K9 units for emergency medical override when a handler is incapacitated. A code phrase never written in manuals. The dog froze, not from fear, from recognition. His head tilted sharply, searching her scent again. She repeated the phrase once, softer, then added a second line. Short, firm, final. Stand guard. Medical clear. Her tone did not plead. It commanded with calm authority. The growl stopped mid-vibration. The dog's jaw closed slowly. His body did not collapse into obedience. It recalibrated. He stepped half a pace back from the gurney, enough space for surgical access, but remained aligned with the soldier's torso. Protective perimeter adjusted, not surrendered. A collective breath released inside the trauma bay. No one moved yet. They were waiting to see if it would reverse. It did not. Emily shifted slightly to the side and gave a subtle hand signal near her hip. 2 fingers, downward sweep. The Malinois lowered himself to a guarded down position beside the table, chin up, eyes still scanning but no longer blocking. It was not submission. It was compliance under authority. The suited federal liaison's expression changed almost imperceptibly. Recognition confirmed. Dr. Harlow did not waste the opening. "Intubate now," he ordered quietly. The respiratory therapist stepped forward in a single controlled approach line, just as Emily had instructed earlier. No sudden angles, no overlapping reach. The tube was placed cleanly. Oxygen levels stabilized a fraction. The surgical nurse moved in next. The dog's gaze followed each motion, but he did not rise. Emily remained within his peripheral field, anchoring the command without speaking again. She knew reinforcement was not verbal now. It was presence. As they prepared to move the patient toward the operating suite, the suited man stepped closer to her, careful not to disrupt the dog's focus. "That phrase," he said in a low voice, meant only for her. It was not accusation. It was inquiry layered with certainty. She kept her eyes on the monitors. "He needed to hear it," she replied. The man studied her profile. There were details he was assembling: her breathing control, the precision of her posture, the fact that she had not once hesitated under federal scrutiny. "That code is restricted to 1 joint task unit," he said quietly. She did not respond. The gurney began to move. The Malinois rose instantly, but did not block. He walked at the soldier's shoulder, disciplined, silent. The hallway outside had been cleared by military police. Hospital staff pressed against walls, whispering. They had expected chaos. Instead, they saw order reasserted through something they could not name. Inside the operating room, lights flared bright and sterile. The dog was positioned just outside the surgical field, but inside the room, per the liaison's directive. He lay down again when Emily gave a slight nod. No words. Dr. Harlow began rapid assessment. Pressure still unstable. Prepare for exploratory laparotomy. Emily moved with the surgical team, her hands steady, instrument placement exact. She anticipated clamps before they were requested, suction before saturation peaked. Not flashy, efficient. The anesthesiologist glanced at her once, registering the difference between training and instinct. During prep, Emily's eyes caught a detail others missed, a faint swelling along the lower rib line inconsistent with initial report. She stepped closer, fingers pressing lightly along the margin. Subtle rigidity, internal bleed worsening. "Possible splenic involvement," she said evenly. Dr. Harlow paused half a second, recalibrated incision plan, then nodded. "Adjust approach." The correction saved minutes they did not have to spare. Across the room, the federal liaison stood still, arms folded loosely, observing everything. He was not watching the surgery. He was watching her. The dog's gaze flicked between the operating table and Emily, trust triangulated. At one point, as cauterization smoke rose faintly, the Malinois shifted restlessly. Emily glanced toward him and gave a minimal hand signal. Steady. He stilled immediately. Authority reinforced without spectacle. Hours did not pass. Minutes stretched heavy instead. Blood loss was controlled. The damaged spleen was addressed. Pressure began to climb back into survivable range. No applause, no dramatic exhale, just incremental stabilization. When the final sutures were placed and the drapes removed, the soldier remained unconscious, but alive. Machines carried the rhythm his body was relearning. The dog rose only when the gurney moved again toward intensive care. As they exited the operating room, the liaison fell into step beside Emily. "You are not a standard recruit," he said quietly. It was a statement. She removed her gloves carefully, disposing of them without looking at him. "I'm a nurse," she replied. He allowed a thin pause. "Formally attached to Joint Task Unit 7, he said. Not a question. Her hand stilled for the briefest fraction of a second before continuing its motion. "That assignment ended," she said. The hallway lights cast long reflections across the polished floor. "Assignments end," he replied. "Training does not." She did not argue. The ICU doors opened ahead. The dog walked calmly beside the bed now, mission adjusted from combat to recovery. Staff members stepped aside without being told. The shift in perception was subtle but complete. She was no longer just the rookie nurse who had spoken out of turn. She was something else. Not publicly named, not formally acknowledged, but understood. As the soldier was transferred into intensive care, the dog settled at the foot of the bed with disciplined stillness. Emily checked the final monitor readings, confirming stability. She did not linger for recognition. She turned toward the sink to wash her hands, movements methodical, shoulders relaxed. Behind her, the federal liaison spoke softly to one of the military police. "Keep this contained." His gaze returned to her once more. The whisper had changed the trajectory of the night, but the night was not finished yet. The moral line. Intensive care was quieter than trauma, but the silence carried more weight. Machines replaced shouting, monitors replaced urgency. The SEAL lay beneath controlled light, ventilator cycling steadily, chest rising with mechanical precision. The Malinois rested at the foot of the bed, chin on pause, eyes half closed, but never fully disengaged. Emily stood at the side panel reviewing vitals, her expression unchanged. Blood pressure had stabilized after surgery, but not comfortably. There was fluctuation beneath the surface, subtle dips that could become something else. She adjusted the IV rate slightly, calculating fluid balance against internal trauma response. No announcement, just correction. 2 senior nurses entered to begin standard ICU protocol checks. One of them, Karen, glanced at Emily with a look that carried earlier skepticism softened by what she had witnessed. "We'll take over from here," Karen said gently. It was not dismissal. It was procedure. Emily nodded, but did not step away immediately. Her eyes remained on the waveform patterns. There was a delay between beats. Not arrhythmic, but compensatory. The kind the body uses when something deeper is wrong. She leaned closer to inspect the abdominal drain output. Darker than expected. Not fresh hemorrhage. Slow internal seep. She felt it before the monitor would show it. The liaison entered the ICU quietly, no longer accompanied by visible armed personnel. He stood near the glass wall, observing the room without interrupting workflow. The hospital administrator hovered behind him, tension still present. "He's stable," the administrator whispered. "For now," the liaison replied. Emily's gaze shifted to the soldier's pupils, checking reactivity under low light. Minimal response. She traced the surgical notes in her mind. Spleen addressed. Hemostasis achieved, but trauma cases rarely follow clean narratives. The body remembers shock. It fights back unpredictably. She reached for the ultrasound unit parked against the wall. Karen looked at her. "Doctor didn't order imaging." Emily did not raise her voice. "Pressure variability and drain output suggest pooling." Karen hesitated. "We just closed him." The liaison's eyes narrowed slightly, listening. Emily met Karen's gaze calmly. "If I'm wrong, we lose 10 minutes. If I'm right, we lose him." The room absorbed that sentence in silence. Karen stepped aside. "Make it quick." Emily rolled the ultrasound into position and applied gel along the lower quadrant. The screen flickered to life. Gray scale patterns formed slowly. She adjusted depth, angled the probe, searching for fluid shadow. There, a dark crescent where none should be. Not catastrophic yet, but expanding. She felt her pulse remain steady. "Call Dr. Harlow," she said quietly. "Possible post-op bleed." Karen moved fast now. The liaison stepped closer, eyes on the screen. "You are certain?" he asked. 80%, Emily replied. It was not bravado. It was calculation. The soldier's pressure dipped 2 points, as if confirming her assessment. The Malinois lifted his head instantly, sensing shift before alarms triggered. His ears pricked, but he did not move from position. He trusted the room because she remained calm. Dr. Harlow arrived within minutes, irritation visible until he saw the ultrasound image. His jaw tightened. "We missed a vessel," he said under his breath. "No blame, just fact. Prep for return to OR." The administrator stiffened. "Another surgery? We operate," Dr. Harlow cut in firmly. Time compressed again. Staff moved with renewed urgency. The liaison turned to Emily. "You overrode chain protocol," he said evenly. She wiped gel from the soldier's abdomen with controlled motions. "I observed a threat." "You could have been wrong." "Yes." She met his gaze without defiance, but waiting would have been worse. There it was, the moral line. Act beyond assigned authority and risk reprimand, or remain silent and risk a life. She had chosen before being asked. As they prepared for transfer back to surgery, the administrator pulled her aside near the supply cabinet. "You are not cleared to order imaging independently," he said in a strained whisper. "You expose the hospital to liability." She listened without argument. "Understood," she said. No apology, no defense. The soldier's bed began moving again. The Malinois rose smoothly and resumed position at the side. The second surgery was faster but heavier. A small arterial branch had reopened under pressure. It was controlled quickly this time. Blood loss minimized. Stabilization regained. When they returned to ICU, the numbers were stronger. Not perfect, but steady. Hours passed into early morning. The sky beyond the high windows shifted from black to deep blue. Emily remained on shift beyond her scheduled hours without announcement. She monitored fluid balance, adjusted sedation levels carefully to avoid neurological suppression, and recalibrated ventilator support once spontaneous breathing signals increased. At one point, the soldier's hand moved faintly against the sheet. The Malinois stood instantly, but did not bark. Emily stepped closer, placing her hand lightly over the soldier's wrist. Not restraining, just grounding. "Easy," she murmured softly. The word was neutral, clinical, but steady. The movement subsided. The liaison approached her near dawn, when exhaustion makes truth surface more easily. "Joint Task Unit 7 disbanded 18 months ago," he said quietly. She did not look surprised. "Yes." "Your file indicated medical discharge." It was accurate. He studied her for a long moment. "You could have requested reassignment." She adjusted the IV pump settings before answering. "I did not." Silence held between them. Machines filled the space. "Tonight will not be public," he said finally. "There will be no commendation." She gave a small nod. "That's fine." He reached into his coat pocket and removed something small, placing it on the counter beside her without ceremony. A folded unit insignia patch, clean, preserved. Not the bloodied one from earlier, a spare. "For clarity," he said, "not recognition." She looked at it only after he stepped away. Her fingers hovered above the fabric, but did not touch it immediately. Cost paid quietly, risk to career, potential disciplinary review, the reopening of a past she had chosen to leave. She folded the patch once more and slipped it into her locker later without display. By mid-morning, the soldier's vitals held steady without fluctuation. Crisis contained, not defeated, just managed. Emily removed her badge lanyard briefly to rub the faint pressure mark at her neck, then returned to charting as if the night had been ordinary. The Malinois lay calmly at the bedside, eyes following her once before settling again. Authority had shifted in that ICU, not through rank or announcement, but through action taken when it mattered. And she carried the weight of it alone. No spotlight morning light entered the ICU slowly, filtered through high windows that softened the edges of machines and metal rails. The crisis energy of the night had dissolved into routine rhythm. Nurses changed shifts, charts were updated, coffee cups replaced adrenaline. The seal remained sedated but stable, ventilator removed, oxygen reduced to a nasal line. His chest rose on its own now, uneven but determined. The Malinois lay beside the bed, body relaxed but alert to every subtle change in breathing. Emily stood at the foot of the bed, reviewing final labs before signing off her extended shift. Hemoglobin holding, pressure steady without chemical support. Drain output clear. She documented without embellishment. No mention of overridden protocol beyond clinical notation. No reference to the code phrase. Facts only. The door opened quietly. A senior naval officer entered in service uniform, posture formal but subdued. He was accompanied by the federal liaison from the night before. The officer approached the bedside first, not speaking, simply observing the man under his command. His gaze shifted briefly to the dog, then to the monitors. Satisfied with what he saw, he turned toward the liaison. "He will recover," he asked. "Yes," the liaison replied. The officer nodded once. His eyes then moved across the room and stopped on Emily. There was no dramatic pause, no public acknowledgement. He walked toward her with measured steps. "You are on duty," he said. It was a statement, not a question. "Yes, sir," she answered evenly. He studied her face for a moment, perhaps searching for signs of the training he suspected. He did not ask about it. He did not thank her in front of staff. Instead, he reached into his folder and removed a small sealed envelope, placing it on the counter beside her chart. "For internal record," he said quietly. "No distribution." She did not open it. "Understood." He inclined his head once, the smallest gesture of professional respect, then turned back to the patient. There was no handshake, no ceremony. Within minutes, the officer and liaison exited the ICU as quietly as they had entered. The room returned to its steady hum. Karen approached Emily after completing medication checks. "Administration wants a brief meeting later," she said carefully. "About imaging authorization." Emily nodded. "I expected that." There was no defensiveness in her tone, just acceptance of consequence. She removed her gloves and washed her hands slowly, water running over skin that still carried faint tension from the night. When she returned to the bedside for one last check, the SEAL's eyes were partially open, unfocused, but aware enough to register presence. The Malinois stood immediately, tail low but steady. Emily stepped into his line of sight first, offering the same calm posture as before. Then she looked at the patient. "You're safe," she said quietly. "No details, no explanations." The soldier's gaze drifted toward the dog, then back to her. His voice was barely formed. "He listened." The words were rough, fragmented by dryness and exhaustion. She allowed herself the smallest nod. "He did." The soldier's eyes held hers a second longer, something like recognition flickering behind sedation, not of her name, not of her face, of cadence, of steadiness. His hand shifted slightly against the sheet, and the Malinois lowered his head gently onto the mattress edge beside it. Emily checked the IV once more, adjusted nothing, and stepped back. Her shift had officially ended 40 minutes earlier. She removed her badge, clipped it to her pocket instead of her collar, and walked toward the staff locker room without looking back again. Inside her locker, folded neatly between spare scrubs, was the unit insignia the liaison had left. She looked at it briefly, then placed it deeper into the compartment behind a stack of plain notebooks. Not discarded, not displayed, just stored. Later that afternoon, administration reviewed the incident. Protocol deviation was noted, justified by outcome. A formal warning was drafted, then reduced to advisory language. No suspension, no commendation, neutral record. By evening, the hospital had moved on to new emergencies, different names, different charts. In the ICU, the SEAL's vitals strengthened gradually. When physical therapy entered the next day, the Malinois stepped aside without growl or resistance. Trust had transferred fully. As for Emily, she returned for her next scheduled shift, as if nothing had shifted in the balance of authority. She restocked supplies, checked charts, spoke softly to anxious families. No one introduced her differently. No one announced what had happened. But the tone around her had changed. Subtle. Staff paused half a second longer before questioning her assessments. Doctors listened more carefully when she spoke, not because of rumor, because they had seen composure under pressure. Near the end of that shift, she walked past ICU room 3. The door was partially open. The SEAL was sitting upright now, pale but conscious. The Malinois sat beside the bed, alert. As she passed, the dog's head turned toward her. No growl, no command needed, just steady eye contact, recognition without display. She did not stop. She did not enter. She continued down the hallway toward Trauma Bay 3, where another ambulance had just arrived. The lights were bright again, the noise rising, the cycle continuing. Authority, once revealed, did not need to be spoken aloud. It lived in action, in restraint, in decisions made without audience. And by the time the hospital quieted again that night, there was no visible trace of what had occurred, except a soldier alive, a dog at peace, and a nurse who never asked to be known for either.